welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com.
Thank you so much for joining us. I'm Kara Mobley, and I am here with John Whitehead and Byron Elam. Byron is with the Tennessee Donor Services External Affairs, and we are here to talk about organ donation because this is National Donate Life Month. Thank you guys both for being here.
You're welcome. Thanks for having us.
So, Byron, tell me a little bit about yourself.
Well, my name is Byron Elam. I work for an organization called Tennessee Donor Services. Tennessee Donor Services is what we call an organ procurement organization. Basically, we make donation happen, tissue and organ donation, throughout most of the state of Tennessee.
Great. Mm-hmm. And John, tell me a little bit about your story.
Well, I got involved with Tennessee Donor Services back in 2005 when my daughter, Sarah Beth, died from meningococcal meningitis. She was healthy. She practiced softball for Trinity Christian Academy. She was doing church league basketball. She was had the flu a couple weeks or a month or so before and didn't feel good Tuesday and then stayed home from school. I worked for Trinity Christian Academy, so did my wife. I was over the property. I had a bus route. So phone call at 3:30 in the morning. It was Sarah Beth. Daddy, I'm cold. And I got up, and she's got a headache, and gave her some aspirin, and she snuggled with her mom, and I went back to bed. I got up 5:30, got ready to go to school to do my bus route. She just got a puppy, and she got Daddy put Duchess in bed with me. I did. And I kissed her. I said, "I see you later, princess." And she said, "I love you, Pops." That's the last thing I heard from her. I'm en route. My wife called and said, "I can't get her up." I said, "Call 911, turn her over on her side." EMT was there within minutes because they did their job. They asked her, was she on drugs, everything. By the time I got to the hospital, we had like 30 people in the waiting room, still unconscious. And I was back there, and I was just looking at her. She was just trouble breathing. So they put her on a ventilator. They did a spinal tap. The fluid came back brown. Her white counts were out of the roof, and they just said it was meningitis. Didn't know what type it was. But at the same time, we had 3 specialists from Vanderbilt in the hospital. I'm thinking, hey, everything's going to be good. And Dr. Johnson wanted to evac her to Vanderbilt. They had everything planned up, so we went up there. She wasn't responsive to any of the treatments they were giving her. And through all this waiting, I asked Dr. Barr, I said, is she eligible for owner donation? And he goes, I don't know, let's check. In the meantime, Teresa's talking to the nurse, asked her the same question. And it came back. The nurse said, yes, she's a candidate. And that's where we got involved with Tennessee Donors. Now, my vision of organ donation was totally opposite. And Brian can relate to this. I thought they just, whatever organ, they cut you open. They really didn't care since you're already gone. They didn't care about
That was
you.
your
That was
understanding at the time.
Understanding.
Right.
And the term harvesting is a no-no. It's not that. Robin was fantastic. And he went through the whole list. There's pages of lists. You can donate tissue, bone marrow, organs. And every time she goes, we can stop anytime you want to. And Robin was fantastic. She changed my mind, and it wasn't that. And so we decided to donate her major organs. Found out there's a 17-year-old boy at that time needed a heart. She got her heart. Right. He was days within. He needed a heart bath, and God sent us to Vanderbilt for that reason.
Right. John, thank you so much for telling that story. Now, Byron, how long have you been with Tennessee Donor Services?
Approaching a year.
Great. Mm-hmm. So when it comes to donating organs in Tennessee, once the organs are donated, what is the process for the person who donated or the person receiving the donation?
Well, I'd say the first step of the process is signing up to become a donor.
Right.
Majority of the people that sign up to become donors do so when they get their driver's license or renew them. But you can also go and do it on our website at any time. The process, I would say, to echo what Mr. Whitehead said, I don't work on the clinical side, so I don't deal with the patients and families every day, but I certainly have shadowed that process and witnessed it. And I cannot say enough about our clinical staff who care for these patients and these families day in and day out. The utmost dignity and professionalism and empathy while these families are going through this very difficult process. It's a very courageous decision, that the Whiteheads made, in spite of that loss. They were able to make the courageous decision to give the gift of life to many other individuals. And that care and empathy doesn't just happen after donation happens. We have a aftercare team within our organization that follows up with these families and provides resources to them as they are dealing with recovering from the loss of a loved one. We're so thankful to families like the Whiteheads who not only are courageous enough to make that decision, but after that decision is made is to continue to advocate for donation because the stories that they tell have the most impact. And so we cannot thank our donor families like the Whiteheads enough for their continued outreach and advocacy and concern. The Whiteheads do so much, particularly I think a couple weeks ago you all had a softball tournament in memory of Sarah Beth and also promoting donation.
Yes, well, speaking of that, when did you start the memorial tournament? We can talk about that.
The tournament started by Ricky Yates at the Sportsplex. His daughter, Brittany, and Sabeth were very best friends. And working on the Plex, Ricky said, I'm going to have a tournament in her honor. Y'all do whatever. We're going to give you a space. You can talk to the teams about her life, donations, meningitis. Tennessee Donors are very big in part, bringing up, there was a group that was meeting about once a month, just a donor family, because it is a hard issue. Yeah, we're a loss of Sir Beth, but we knew the donations, the organs helped us to cope. In speaking about her, I spoke to Kiwanis clubs. We speak to the CRNA class and union about it. That's how I found more how the transplant team, what they do, and how the caring that they take. I mean, it's not like everybody thought the bad thing. They take such a great care of that person. It's unbelievable. My wife's best friend, Molly Wright, Dr. Wright, was telling her how she was a nurse anesthetist, how the doctor would look at her and say, you can go now. She was saying, I can't leave my patient, knowing the patient was already left. But Molly, that's my patient. And they talked to other transplant team a couple of years afterward. We spoke in Vanderbilt. They were talking about how hard it is for them knowing. I mean, it's kind of a catch-22. They know what they're doing to save lives, but again, they knew a life is lost. So it's kind of like it's tough for them too. Exactly.
Yes. So why do you think more people don't register to become organ donors, or how important do you think it is to share that information to people, across the country, but also in Tennessee as well?
I think there are a lot of myths surrounding donation. We hear a lot of them. One of them we hear a lot is that, if they know I'm an organ donor, then they won't go through the proper measures to save my life. That couldn't be further from the truth. All life-saving measures are pursued and completed. Donation only comes into conversation when it is evident by the medical team that survival is not take place. So we hear that a lot, there are some other myths, surrounding donation. And it's a scary thing to talk about because we talked earlier a little bit about the difference between living and deceased donation. Tennessee Donor Services, we only conduct deceased donations. So, a lot of people don't like to talk about that, the end of life,
Right. It's not something they want to talk about, but it's so important.
Yeah. It's not a comfortable topic, but it's something that's inevitable for everyone. And that, to be able to give that gift, once our lives are over, potentially give that gift to save someone's life or even to enhance someone's life, I think is an important part of end-of-life discussions.
Yeah. Exactly. One thing about it is, like I said earlier, one of the myth is that they just don't care about the person, which is totally false. One of the myth is that it's my body, I'm going to take it with me. I don't want nobody cutting me open. I've heard the same thing. Well, I'm a donor, they're not going to save me. Yeah, they will do whatever it takes.
Right, and I feel like a lot of that is these physicians and things, they're not looking at your driver's license while they're saving your life. Yeah. That comes into play once, you don't even know about that until everyone starts to have to make that decision.
And the key thing about it is, and Brian's going to tell your next of kin, I'm an organ donor right here. I want to donate ABCD, or donate, for me, I told my wife, everything they can take it, whatever they can use.
Right.
They were one of the visions I have for Sarah Beth as we left the hospital. The recovery team was around her, just measuring everything's she's a candidate. They still look at you. Is she a good candidate? They'll go through the process of finding out what can they do. As we talked about earlier, I was a heavy drinker, smoker. Just give the recovery team a chance. If it's not I guess that's not a viable organ, they're not going to put it in somebody else. They will just give the recovery team a chance to.
Right. There are so many different ways to donate that some people might think they're ineligible when really they're not.
Right. Like that's another myth. People think, well, I'm too old or too sick. You'd be surprised there have been people in their 90s that have been organ and tissue donors. Like I said, each case is, like Mr. Whitehead said, each case is evaluated individually to see which, organs or tissue are viable for donation. And be surprised, that many times, people think they're too old or sick, and there is something that can be recovered to help or improve someone's life.
Right. My grandfather was in his 70s, and he had a lot of health problems, but they specifically took his cornea. Now, he had bad eyesight, but they were like, oh, we can still use it. So, it can definitely still be used.
Right.
Yeah.
So over the years, in terms of the gift of giving an organ, how has that impacted your life? In what way did you go forward? Did you meet any of the families of the people who received those, and how has that worked out?
We sent a letter out to the family describing, so we couldn't use the last name. There was some confidentiality still there. Sent to TDS, and they looked it over, then they mailed it to the recipient. And then we received letters back. We received back from 3 of them. We found out who they were. They didn't have a name, but this is a man that liked the rabbit hunt, blah. Lung recipient that we met a year later after Sarah Beth passed. And we listened to her. We met him, became good friends with him, and he couldn't walk up 3 flights of stairs. Now, with a new lung, he could do that and watch his granddaughters play softball in Mississippi. So we met him. And so it's kind of neat. It's changed that we speak to people at a drop of a hat. I wouldn't hesitate in talking about TDS. Softball tournament been going on since 2008. I think we spoke to around 5,000 student athletes and coaches about this. So somewhere there, just allowed us to get out of our comfort zone to speak to somebody about organ donations, and it kind of it gave us another way of remembering Sarah Beth and honoring Sarah Beth.
Right. So if somebody wanted to find out more information about organ donation in Tennessee, where could they go, and how could they gather that information?
DonateLife.Tennessee.org. Information there. Be happy to answer any questions or give me a call. Be happy to talk to you about it, or anyone in our external affairs staff will be happy to talk to you about donation in Tennessee. I think one thing to highlight is the need. About 100,000 people in this country right now are waiting for an organ. About 3,000 people in Tennessee. So they're they're neighbors and friends, people that we go to church with and go to the grocery store with, are waiting for an organ this very moment. And the only way that need can be met is by folks being courageous enough to be willing to sign up and be the gift.
Exactly.
We always said that, and people are trying to put it up in perspective, you say 100,000, say you can fill Neyland Stadium with people waiting for organs or tissue. That gives people an idea of the need of it. In fact, my sister-in-law was a lung recipient a couple of years ago, and which was, again, we're on both sides now. And Teresa had surgery, and they took donor bone to replace a bone that was in her neck. So she was, again, there's stuff you can donate.
Right, and it's just one person's donation can impact so many more people's lives.
Yes, countless. One person can impact dozens of lives through the gift of donation. Mm-hmm.
Of the people who are donating their organs, are there any disparities there?
There is a disparity. Among the 3,000 folks on the wait list for organs in the state of Tennessee, disproportionately that number impacts African Americans. A higher percentage of African Americans are on that waiting list in comparison to the population. So we're working to try to increase, and of course African Americans are not registering to be donors in proportion to their population. But we're doing the best we can to increase those numbers, because from a medical perspective, when you have someone from the same race that's donating, it increases the chances of that donation being successful.
Right.
So it is crucial that we have diversity among our donors and those that register.
All right. Well, is there anything else you guys wanted to talk about that I didn't cover?
As Byron said, there's a lot of myths out there. If you got a question, please contact TDS. So, hey, what about this? What about that? A lot of people just don't know. They don't think about it. And that's just something there that they just need to.
Right. Getting the information out there and getting the correct information to people to understand the impact and what's actually true about it.
Yeah.
So April is National Donate Life Month, and on the 14th of this month is National Wear Blue and Green Day. So we want to encourage people on the 14th to wear blue and green to bring awareness to organ donation. Well, thank you both so much for being here and talking to us about this very important topic that's
It's
such
near
an
and
impact.
yeah.
Yes, near and dear and so important for people
Thank you.
and those in need. Thank you guys.
Thank you so much.
Thank you.
Thank you.